Hi everybody, my name is Mitchell Farmer and today we're going to discuss Laboratory 2 of the MSK block, covering the gluteal region and posterior compartment of the thigh. So the first thing I want to talk about was the gluteal region, starting with gluteus maximus. So gluteus maximus's proximal insertion is the posterior surface of the ilium, as well as the dorsolateral aspect of the sacrum and coccyx, highlighted here, as well as from the sacrotuberous ligament and the posterior sacroiliac ligaments. Now, gluteus maximus has two important distal insertions. It has the gluteal tuberosity on the posterior aspect of the femur, but it also attaches onto the iliotibial tract. The iliotibial tract is a thickening of the lateral aspect of the fascia lata, highlighted here, created by the blending of the fascia lata and the aponeuroses of gluteus maximus. It inserts very distally all the way onto the anterolateral tubercle of the tibia. You can see this anterior view, and here highlighted is the iliotibial tract. And I'll take us back to a posterior view. The blood supply of gluteus maximus is the superior and inferior gluteal artery and vein, which I already demonstrated where they come from in repro block. Its action is largely a hip extensor, but it also aids in abduction as well as lateral rotation of the thigh at the hip. I'm just going to show you hip extension here really quick. Here you can see gluteus maximus, and as its fibers tighten against the gluteal tuberosity, the femur is pulled backwards and across relative to the hip joint, and you get hip extension. And finally, its innervation is the inferior gluteal nerve, which is highlighted here, and if you can recall, gets its name because it exits the greater sciatic foramen inferior to the piriformis muscles, highlighted here. So now I'm going to hide gluteus maximus, and we can move on to gluteus medius and gluteus minimus. So they're both, and I'm going to hide this guy here, so you can see gluteus minimus, and here you can see gluteus medius. They're both innervated by the superior gluteal nerve and supplied by the inferior and superior gluteal arteries. They share a similar proximal attachment on the lateral surface of the greater trochanter of the femur, but they have different distal attachments. Or sorry, opposite. They have same distal attachments, but different proximal attachments. As can be seen, gluteus medius attaches all the way to the top of the iliac crest, whereas gluteus minimus attaches far below that point. But they both have the same action as well. They both function to abduct the femur at the hip joint and provide medial rotation of the thigh about the hip joint. Now I'm going to hide both of them on either side. I'm also going to get rid of the inferior gluteal nerves on either side. And now we can move on to piriformis, as seen on the model's left here. So if you recall, piriformis proximal attachment is the anterolateral aspect of the sacrum. So highlighted here is the sacrum, and you can see piriformis coming off it, exiting through the greater sciatic foramen, and then distally attaching to the greater trochanter, seen here. It's innervated by S1 and S2, and its action is it's an abductor of the flexed femur at the hip joint and a lateral or external rotator of the extended femur at the hip joint. If you recall, as I stated previously, it also helps to divide the greater sciatic foramen into superior, including the superior gluteal artery and vein, as well as inferior, seen here and here. Also, you should be able to find the sciatic nerve passing inferior to the piriformis muscle and occasionally piercing the piriformis muscle in certain aberrancies. So moving inferior from piriformis, we come to, first I'm going to discuss obturator internus. So obturator internus lies between the superior here and inferior gemellus muscles. And that's how they get their name. One is superior to obturator internus, one is inferior to obturator internus. Its proximal insertion, if I rotate to the front of our model and kind of tilt this up here, you can see that its proximal insertion is on the inside of the obturator foramen, or the obturator membrane, whereas the obturator externus can be found on the outside of the obturator membrane. So you can see it it attaches on the inside of the obturator membrane. And if I hide here, you can see that it wraps almost at a 90-degree angle around the ischial tuberosity in order to come back and around and attach to the greater trochanter. Its action is it helps laterally rotate the femur at the hip joint, as well as abducts the flexed femur at the hip joint. So basically the exact same as the piriformis muscle. And note that it, as well as the other two muscles I'm about to talk to, exit the pelvis via the lesser sciatic foramen, whereas piriformis exit via the greater sciatic foramen. So, onto the superior and inferior gemelli muscles. So, they're named relative to the location obturator internus, as I stated, and they're lateral or external rotators of the hip. And in fact, I'll just take a second here to show you exactly what I mean by that. So, I've selected the lateral hip rotation, and if I just settle here and you just focus on the knee, you can see how the femur is turning laterally or externally relative to the hip. That is a lateral hip rotator. And unfortunately, it's hard to show you the action of the muscles I was talking about because gluteus maximus is in the way and I can't hide it in this version or in this mode. But you can definitely see what exactly I'm talking about when I say lateral rotation when I use this mode. So I'm going to exit. We're coming back. Once again, we're at a posterior view of the model. That's basically all I have to say about the superior and inferior gemelli muscles. They're relatively weak, but they help in lateral hip rotation. Now, the final one I want to talk about is the quadratus femoris muscle. So quadratus is Latin for square, and that's because this muscle is largely square-shaped. And similar to the gemelli muscles, it's an external or lateral rotator of the femur at the hip joint. Okay, so that's pretty much everything I wanted to talk about as far as just muscles are concerned in the gluteal region. I'm going to open up my posterior thigh model now so that we can get on to covering that. So before we get started, I want to talk a bit about the sciatic nerve and the innervation of the posterior thigh compartment. So the posterior thigh compartment is innervated by the sciatic nerve, and the sciatic nerve originates from L4 all the way to S2. So L4, L5, S1, S2, and S3 spinal nerves. The ventral primary rami of spinal nerves, to be specific. And as you can see, it exits via the greater sciatic foramen inferior to piriformis muscle and travels all the way inferior distally until it splits into the tibial nerve and the common fibular nerve. One other thing I wanted you to recall right now while we're just covering the posterior muscles is that these are the hamstring muscles. And so if you remember, adductor magnus, which I've highlighted here, has a hamstring portion. This is anterior now. Has a hamstring portion that are vertical muscle fibers seen here. Now just look at the location of that hamstring muscles as I move posteriorly relative to the tibial nerve. It's quite close, and so it makes sense that the tibial nerve provides innervation to that portion of adductor magnus as opposed to the obturator nerve, which innervates the rest of the medial compartment of the thigh. So, on to the posterior compartment of the thigh. These muscles essentially extend the thigh about the hip joint and flex the leg about the knee joint. The muscles of the posterior thigh are also kind of split into two masses as you move inferiorly. So if I zoom in and you focus on the models right here, you can see that as they move inferiorly, they kind of split into two muscle masses, which I'm trying to show you right here. The lateral mass, highlighted here, is composed of the biceps femoris, whereas the medial mass is composed of the semitendinosus and semimembranosus muscles. So I'm going to start us off on the biceps femoris. I'm going to zoom out and just show us the full length of it. So the biceps femoris, its function is it flexes the leg at the knee joint and extends and laterally rotates the thigh at the hip joint. It has a long head and it has a short head. So here's the long head and here is the short head. Starting with the long head, its proximal attachment is the ischial tuberosity, which I've shown you many times, but here's highlighting the ischium. Ischial tuberosity is approximately here, and the biceps femoris long head attaches to that. The short head attachment short head's proximal attachment is the linea aspera, which if you recall is that roughened ridge on the posterior aspect of the femur. However, they share a common distal attachment and often a common tendon, and that is the lateral head of the surface of the fibula. So I've highlighted the fibula here, and they both attach to that lateral aspect of the fibula. The long head is innervated by the tibial portion of the sciatic nerve, whereas the short head is innervated by the common peroneal portion of the sciatic nerve, which if you recall just to a couple of minutes ago, are the two divisions of the sciatic nerve I was talking about. The common peroneal laterally, and the tibial nerve splits medially. So, I'm going to hide that biceps femoris long head and short head, and now let's move on to the semimembranosus muscle. So one of the ways that when I was doing MSK, I tried to remember the semimembranosus versus tendinosus is that the semimembranosus muscle is the most medial, whereas the semimembranosus highlighted here is the most medial, whereas the semitendinosus is on top. So tendinosus top, it's on top of the membranosus. So actually I'm going to start with semitendinosus, and its proximal insertion is the ischial tuberosity, which I've shown you with a bunch of different muscles, and its distal insertion is the medial surface of the proximal tibia. Seen here. Here's the tibia, and it's just the medial surface of it. Nothing particularly important to remember. What'll really help identify it in the cadaveric dissection is this, sorry, it's being a bit wacky on me, is this really, zoom in here for you here, this really long and distinct tendon, which will be immediately identifiable when you're doing the cadaveric dissection, look at the posterior aspect of your model. So now I'm going to hide it, and here's the semimembranosus. Once again, its proximal insertion is the ischial tuberosity, and its distal insertion is the medial condyle of the tibia, very similar to semitendinosus. They also do the exact same thing, basically the primary function of the posterior thigh, that which being hip extension as well as knee flexion. And I can show you that if you want. I've done hip extension a bunch, but if we have a look at knee flexion, this is a lateral view, that is the action of knee flexion. And you can see how the biceps femoris and the semitendinosus and semimembranosus muscles would aid in that as they do cross the knee joint. So recall that axiom that if a muscle crosses the joint, it's going to cause action in a plane of that joint. So now I'm going to exit out. And that's basically it for the posterior compartment. The last thing I wanted to discuss real quickly is the blood supply. So you remember when I was describing how you have the profunda femoris as one of the branches of the femoral arteries? Well, one of the things you'll be able to see in your cadaveric dissection is that it gives off what are known as perforating branches to help pierce the adductor magnus and supply blood to the posterior compartment. It's not well shown in the model here, but definitely have a look out for that when you're doing the cadaveric dissection. Okay, so that's everything I want to talk about for that. The very last thing I want to discuss in this video is the popliteal region of our model and of the cadaveric dissection. So before diving right into it, I just wanted to do a quick vessel recall, just reminding you of some vessels and exactly where they're from and what they do. So I'm going to go around to the front here and just look at the models right. So just remember that you have the aorta descending. It splits into the common iliac artery, which has internal and external portions. The external portion turns into the femoral artery once passing the inguinal ligament. If we follow the femoral artery and vein, it travels through the adductor hiatus, and then if we rotate to have a posterior view, once traveling through the adductor hiatus, I will hide this, it becomes the popliteal artery and vein, okay? And the reason that's important is because those are going to be some of the components of the popliteal fossa, which I'm now going to discuss. So if we look at the models right, just remember this is a posterior view we have here. Actually, let's look at the models left. And I'm going to put back in the biceps femoris, just so I can go over the Oh, sorry, that's the biceps brachii. I was wondering, where is it? All right, just so I can go over the boundaries a bit better of this guy. I guess I'd also need the semimembranosus and semitendinosus. So new plan. I'm going to put in the gastrocnemius of the right side. Ta-da! There we go. Sorry about that. So the boundaries of the popliteal fossa. So the upper lateral boundary, so this is lateral, medial, we're on a posterior view. So the upper lateral boundary is the semitendinosus muscle right here. The upper medial, the biceps femoris right here. This upper medial boundary is the semimembranosus and tendinosus muscles. Here, semitendinosus, and then deep to that is semimembranosus. Whereas the lower boundary is the medial and lateral head of the gastrocnemius muscles. So that's this guy and this guy right here. And those are essentially the calf muscles, so to speak. So this diamond shape that I've now shown you here, that is the popliteal fossa that we're about to be discussing. So at the superior angle of the popliteal fossa, which I'm going to show you on the left-hand side here, get rid of this guy. At the superior angle of it is where we usually see the split in the sciatic nerve, in which case we get the tibial nerve, which lies superficial to the popliteal vessels and bisects the fossa as it travels between the superior and inferior angles of the fossa. So seen on the models right here, you can see that it's superficial to the popliteal artery and vein, and that it's kind of bisecting the fossa into like right and left components. And as it travels inferiorly, now I'll hide the gastrocnemius, as it travels inferiorly, you can see that it passes deep to the tendinous arch of the soleus muscle, highlighted here, as well as deep to the heads of the gastrocnemius muscles. It innervates all the muscles of the posterior compartment of the leg and all the intrinsic muscles of the foot. So the posterior compartment of the leg is something I'm going to discuss in next lab, but essentially it's the calf muscles, it's the soleus muscle, it's a couple more, and I'll discuss them later. And then there's also the intrinsic muscles of the foot, which I will also discuss later. But just remember for now that that's what the tibial muscle, or the tibial nerve innervates. Just one important branch I wanted to talk about of the tibial nerve before moving on is the medial sural cutaneous branch, highlighted on the model's left now. So the medial sural cutaneous nerve descends superficially between the two heads of the gastrocnemius. Here's the two heads. You can see it descending between those two heads. And it's joined by the sural communicating branch, seen here, which is a branch of the common fibular nerve. Alright, and the reason that it's important is it provides sensation to the skin covering the posterior lateral aspect of the leg, the lateral malleolus, and the posterior and dorsolateral aspects of the foot. This is going to be stuff that you're going to learn a lot more about in MSK when you're talking about like what are the cutaneous innervations of the legs and the arms and all that sort of stuff. But just recall that the sural nerve, the medial sural nerve, and the sural nerve are kind of what make that possible. Now, moving on from the tibial nerve to the peroneal nerve. So the peroneal nerve, once again, the common peroneal or common fibular is another name for it. If you hear that, it's the same thing. Recall it's a division of the sciatic nerve, and then it follows along the medial border of the biceps femoris. So here's the short head. And it leaves the popliteal fossa by crossing superficially to the lateral head of the gastrocnemius. So here's the gastrocnemius, here's the lateral head, and you can see that it crosses superficial to that to leave the popliteal fossa. And then, as it descends inferiorly, it winds around the head of the fibula, seen here. So it winds around the head of the fibula, and then kind of travels into the anterior compartment, which if I rotate around, this is kind of the roughly the area of the anterior compartment. Now, it innervates all the muscles of the anterior and lateral compartments of the leg via the deep peroneal and the superficial peroneal branches. So the common peroneal splits into the deep and superficial branches of it. And this will be covered in more depth when we're actually going over the anterior and lateral muscle wads. So Don't worry about it for right now if you're not getting this. I will cover it again later. And then a final note on it is it also provides sensation to the skin covering the anterior lateral aspect of the leg and the dorsum of the foot. Okay, so the final thing I want to discuss in the whole lab is the popliteal artery. So the popliteal artery, recall, is a continuation of the femoral artery. And as you follow it distally, it travels inferiorly through the popliteal fossa, and then it divides into the anterior, highlighted here, and posterior tibial arteries. So the popliteal divides into two tibial arteries, anterior and posterior, at the inferior border of the popliteus muscle just deep to the soleus. So I've taken away the soleus, but here's the popliteus muscle. So if you find that in the cadaveric dissection, look on its inferior border and you'll probably find that anterior-posterior division of the popliteal artery. Okay? This area of the body is going to be covered in more depth in the next lab or the next video. So if you didn't catch all of that, that's fine. And I will see you for that next video. Thanks.